Today's focus is on head injuries, which can range from minor bumps to serious trauma involving the brain. A minor head injury may cause bruising, swelling, or a mild headache. However, more serious signs need urgent attention. Look out for drowsiness or confusion, vomiting, unequal pupils, seizures, bleeding from the ears or the nose, memory loss, or changes in behavior. And here's what to do. If the casualty is conscious, help them to sit or lie down. Apply a cold compress to any bump or bruise. Monitor them closely for signs of deterioration. If they become drowsy, vomit, or show any warning signs, call 999 or 112 immediately. Never leave someone with a head injury alone until they are fully alert and well. For children, always seek medical advice after a head injury, even if the symptoms seem mild. Head injuries can escalate quickly, so stay alert.